going to be covering choking infant and first aid that we need to provide for a choking infant all the way up to CPR. So an infant, so we'll cover training points, and then I'll go over an actual scenario where we don't pause anything and just run all the way through it. So step one, or consideration number one, is infant. What is an infant? So that's someone from the ages of 1 month to 12 months of age. Some first aid considerations that you might want to think about are buying a life vac, which we do teach courses on life vac with infants, adults, and children. I will be doing videos on this later on. Some first aid kit considerations will be CPR masks. So having a CPR mask with a one-way valve and or a pocket keychain mask. Now these are considered barrier devices. It's going to help to prevent spread of bacteria, germs, and things like that from baby to me or from me to baby. A third consideration when it comes to airways, if you don't have a barrier device or a pocket keychain mask or a CPR mask, is just straight mouth to mouth. With an adult, based on the distance between an adult's nose and mouth, we typically, if I'm providing mouth to mouth with an adult, which is only going to be my family, sorry, but I'm going to place my mouth just over the adult's mouth. Now, if you're providing CPR or rescue breaths to an infant, your mouth will go over the baby's nose and mouth, because the distance between the nose and the mouth is so close. So 12 months to a month, consider a life vac. It's a choke and relief device, CPR mask and or pocket mask and or airway, mouth to mouth. When it comes down to choking, I like to break it down. So we teach a choking first aid class, and most choking first aid in America is pretty atrocious. It's about a 4-minute video with no hands-on. When it comes down to infants or anybody who's choking, I break it down to 4 stages. Stage 1 is just a minor cough. We're not too concerned unless it's like the whole COVID thing or whatever. Phase 2 or stage 2 would be they're actually starting to forcefully cough. We might see some color change in the baby. Baby is becoming frantic. In stages 1 and 2, baby is still moving air and just coughing. When the baby is coughing during stage 1 and 2 of choking, we do not want to pat the baby on the back, and we don't want to stick our finger into their mouth because the baby's still moving air. If I pat the baby on the back or try to reach into the mouth, I might actually lodge the object deeper into the throat and actually push them into a full-on choking scenario or situation. Now, during stage 2, I've responded to plenty of calls where parents, grandparents, caretakers are very concerned because the baby is coughing very forcefully, turning bright red and possibly minorly a little bit blue. I don't fault anybody for dialing 911 in that situation because it isn't too long before somebody goes from a severe, or an infant could go from severe coughing into a full-on choking situation. So I've responded to those calls. I wouldn't fault you for calling 911 at this point. But phase 1, stage 1, phase 2, stage 2, they are still moving air in and out. Do not pat on the back. Don't sweep into the mouth. If you are concerned, call 911. If we get to stage 3, that's where the baby is not moving air anymore because the obstruction has gone from mouth, upper airway, and is lodged in the throat. And they are no longer moving air. Eyes are still open. They are still moving frantically. You're probably going to see deep red in color, possibly blue around the lips, maybe even turning blue throughout their body. So they are not moving air. Definitely at this point, you need to call 911, okay? You could call 911, put it on speaker. I would also advise opening the front door and possibly getting out onto the porch or out front somewhere. If the call drops or if you accidentally hang up, as we respond 911, sometimes we can actually GPS locate the exact location to where the phone is. We may just see a typical location within 3 to 5 or 10 houses where that phone is being pinged. So if you open the door and step outside, as we're responding, coming down the street, we see an open door. That's probably where we're going to go to first. So stage 3, baby is no longer forcefully coughing. Baby is now not moving air. The obstruction has fully blocked the airway, but the baby is responsive and looking around. That's where we're going to go into our back blows and chest thrusts. Phase 4, baby is no longer moving air. Baby is not responsive and completely unconscious. We'll go into CPR. So much like I freaked everybody out the other day with, hey, you might paralyze your baby, make sure we get down to a knee, right? So phase 1, 2, we're not doing back blows or chest thrusts. We're not sweeping into the mouth. Baby's moving air. Make sure you call 911 if you're overly concerned in phase 2. If they actually stop moving air, you absolutely need to call 911 at this point. The baby's responsive. Now we're going to go into our back blows and our chest thrusts. So we're going to make sure, once again, you are down low to the ground. I'm going to sweep my arm under the baby's legs, making sure at that point that my hand is now cupping the jaw of the baby just like this. I'm going to take the baby's leg and tuck the baby's leg between my arm and my chest, ensuring the baby is at a downward angle like this. Going between the shoulder blades, I'm going to take the palm of my hand right here, my palm of my hand, and I'm going to forcefully provide 5 back blows between those shoulder blades. 1, 2, 3, 4, 5. Sandwich the baby, rotate the baby over. I'm going to slide this arm back, grabbing that leg, drape the legs over my arm. I'm going to pinch the baby's leg between my arm and my chest. Worst case scenario, if the baby slips, I still have positive control and I'm low to the ground. We're not going to injure the baby. Baby's angled down at about a 45-degree angle. 2 fingers between the nipples here, in line with the nipples, in line with the sternum. Provide 5 chest thrusts. 1, 2, 3, 4, 5. Sandwich the baby, grab the leg, trap the leg. 1, 2, 3, 4, 5. Sandwich the baby, grab the leg, pinch the leg. 1, 2, 3, 4, 5. Sandwich the baby, grab the leg, pinch the leg. 1, 2, 3, 4, 5. Remember, the baby is responsive. Okay, eyes are open, baby's moving around, baby is fighting for its life. At this point, if we do clear the airway, the object comes out, the baby starts moving air and crying. We want to put the baby in the recovery position. Do not hold the baby like this. Okay, once you clear that airway, if the baby starts crying, you don't want to hold the baby like this because gravity is going to work against you, and any vomiting or spit or other objects that are coming out of the stomach and or lungs, gravity is just going to assist including or blocking that airway again. So we want to put the baby in a recovery position. So we have baby like this. 5 back blows, we clear the airway, baby starts crying. You can simply rotate the baby over like this. I've got positive control of the baby. My hand is still around the baby's jaw and the baby's angled forward. So any vomit, spit up, whatever you want to call it, can still come out of the mouth, and we're assisting, gravity is now assisting us to clear that airway. You could also sit the baby on your leg like this and hold the baby forward so they can vomit and cough and start to breathe this way. Once you do clear the airway, baby's still responsive. Keep the baby in a recovery position so that we can assist the airway being cleared. Make sure that 911 takes the baby to the hospital. There are plenty of times I've seen paramedics are confident that once you clear a baby's airway in the home that it's okay to stay at home. My advice is do not do that. Go to the hospital no matter what in an ambulance. Okay, so now let's go to phase 4 where we are providing back blows on the baby. Baby's angled down, 1, 2, 3, 4, 5, and now the baby becomes unresponsive and limp. There is no muscle tone. The baby is not working to fight for its life. The baby's blue, unresponsive. We are now in stage 4 of choking. We have a blocked airway. There's no airway moving. We're now going to transition into CPR. Okay, so when we go ahead and transition to CPR, we're going to go ahead and lower the baby to the floor. Now with infants in CPR, we are also providing 30 compressions and 2 breaths. When we get to the mask or the barrier device and the baby is unresponsive, the way a mask works is we have a point up here, we have a rounded portion down here. I'm going to take the index finger, the webbing on my hand here, and my thumb, and I'm going to marry that up to the plastic where it meets the rubber here like this. When we do that, we're going to press down on the baby's head, sealing this mask to the baby's face. We want to make sure that the point goes to the bridge of the baby's nose like this, and then my index finger and my thumb are right here. My other thumb is going to pinch here, and I'm going to bring that mask down. We're trying to give a nice circumferential seal between the baby's face and the mask. Point of the mask, bridge of the nose, press down here, pinch here, and then I'm going to do a nice head tilt, chin lift. So with the outside portion of my hand, I'm going to rock the baby's head back, getting them in a nice sniffing position, and then I'm going to deliver my 2 breaths. That's the mask. With the 30 compressions, when we give 30 compressions and 2 breaths, it's 30 compressions for adult, child, and infant. There are 2 techniques for an infant to give 30 compressions. Those are going to be 2 thumb circling techniques. So my 2 thumbs are going to be in line with the nipples here, right in the center of the sternum. My hands are going to wrap around the side, and we're just going to compress approximately 1.5 inches. The other technique will be 2 fingers in line with the nipples here, in line with the sternum, pressing right here. How that looks when they're on the floor. 2 thumb circling technique right here. 2 finger technique will be pressing here. Delivering 30 compressions, and then we'll go ahead and transition into our mask. in our breaths, whether it's a mask, barrier device, or mouth to mouth. So if we're using a mask, I've kind of demonstrated that already. We're going to place this C here, place our hand here, head tilt, chin lift, and pinch. When you deliver those two breaths, each of those two breaths should only be 1 second in length, no more than 10 seconds total trying to deliver those two breaths. The goal here is not to get the air in. Well, the goal is to get the air in. But if you don't see the chest rise, the goal is to see the chest rise. If you don't see the chest rise with each breath, we're going to go ahead and attempt the second breath. If the chest doesn't rise again, that's it. 2 attempts at breaths, that's it. And then we transition back into 30 compressions. So 30 compressions, place your mask. Attempt your 2 breaths. If you see the chest rise, go ahead and transition to the second breath. If it doesn't rise, attempt your 2 breaths and go into your 30 compressions. So we're going to work with 30 compressions and 2 breaths. With a barrier device like this, like I said, this is an adult mask or adult barrier device. We're going to take the barrier device, take the white portion, and make sure we're at least covering the mouth. Typically on an infant, the white portion of that mask, of that barrier device, will go over the nose and the mouth, just depending on the manufacturer of the barrier device. So I'm going to place that barrier device over the mouth and the nose. Same thing, place my hand here, tilt their head up, back, pinch right here. Look for that chest to rise. If it rises, great. If it doesn't, I'm going to go for my second breath, second attempt. After I give those 2 breaths, move back into 30 compressions. If I don't have a barrier device, I'll give my 30 compressions, look in the airway. If I see something, clear it out. If I don't see anything, I just transition into using CPR mask, barrier device, or mouth to mouth. Remember, with mouth to mouth with an infant, our mouth is going to go over their nose and over their mouth. We're going to deliver those 2 breaths. Those 2 breaths are 1 second in length per breath. We should not spend more than 10 seconds total trying to give those 2 breaths. So give my 30 compressions, look in the airway. If I see something, sweep it out. If I don't put your fingers in the mouth. And now I transition to those 2 breaths. Looking for that chest to rise. If it rises, great. If it doesn't, I transition to the second breath. If it rises, great. If it doesn't, go back into my 30 compressions. Now, if I'm using a mask, barrier device, or mouth to mouth, if there's a blockage in the airway, there's a good chance you're not going to see the rise and fall of the chest because there's an obstruction there, okay? Then we just keep working 30 compressions, look in the airway, attempt 2 breaths. 30 compressions, look in the airway, clear it if you see something, attempt 2 breaths. Wait till EMS gets here. I've provided CPR and choking relief on plenty of aborted babies, infants, adults, and children. It's an intense situation, okay? Just ground yourself, get low to the ground, 30 compressions, look in the airway, attempt 2 breaths, and just keep working that process, okay, until 911 gets here. If you do clear the airway, okay, and the baby starts to cry before 911 gets there, you want to place the baby in recovery position. We don't want to leave the baby on their back. Same thing with before. We don't want to hold the baby like this because gravity is going to work against us and can also start to trap that object or any other phlegm, vomit, or spit into their throat, possibly blocking their airway again. So once we bring the baby up, we clear the airway. We can hold the baby on the side like this, rotate that baby forward so that the airway is pointing down. You can sweep a leg through here, support the jaw, let that airway angle down so that the spit, the vomit, and stuff come out of the airway, or sit that baby on your thigh, lean them forward, keep positive control in their head. At this point, in all reality, the baby is probably very deeply blue and will be struggling to breathe, intensely struggling to breathe, okay? And it is a very scary situation. Just work the 30 compressions, look in the airway, clear it if you see something, and attempt those 2 breaths. If the baby starts breathing, put the baby in recovery position or lean the baby forward. So for the scenario, I'm going to go ahead and use a mask. Let's say you're at home, you hear baby coughing, baby's in a high chair. We don't have infants anymore. All of our boys are grown. So we're just going to use this chair here. We're at home, step out in the kitchen, come back, baby's in the high chair. We hear the baby coughing. You've probably heard it 1,000 times. It's not really a big deal. That's stage 1. Stage 2 is now you're looking at the baby. Baby's possibly turning red, starting to look a little bit frantic, maybe starting to become very frantic in their movements. That's stage 2. They're still moving air, right? Air is coming in. Air is going out. You may hear some wheezing. You may hear some, you're going to definitely hear some forceful coughing. You may see them turning red, possibly blue around the lips, okay? If you call 911 at this point, I would not fault you. We've responded to tons and tons of calls for folks who call 911 when their children and other adults or family members are in that situation. No fault, right? Remember, at stage 1, when the baby's coughing, we don't want to pat the baby on the back. Stage 2, we don't want to pat the baby on the back. So then we go into stage 3, where the airway is now fully blocked. The eyes are open. Baby is moving. That's our back blows and chest thrust. Stage 4 is the baby has become unresponsive. Baby is not intentionally moving or moving at all. The eyes may be open or not. Baby's probably fully blue at this point, and now we're transitioning into CPR. 30 compressions, look in the airway, clear it if you see something, and provide those 2 breaths. So you're at home, I hear baby coughing, not a big deal. I hear the baby starting to forcefully cough. I come out, check on the baby. Baby's starting to look blue. I'm going to go ahead and actually bring the baby down, support the baby, kind of sit the baby forward. I hear baby starting to actually cough even more forcefully. I'm starting to hear a wheeze. I'm looking, becoming frantic. I see the baby starting to turn blue around the lips. I'm going to yell out to my wife or somebody, call 911, get our first aid kit. The baby's starting to choke. At this point, I'm not patting the baby on the back. I'm just watching baby, sitting baby forward. And unfortunately, now the baby stops breathing completely. Baby's turning blue. I'm going to go ahead and sweep under, trap the arm, trap the leg between my arm. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Baby's still moving. I hear my family calling 911. 3, 4, 5. First aid's coming from the kitchen. 1, 2, 3, 4, 5. Oh crap, the baby's not breathing. Baby's not moving. Baby's completely blue. Now we're moving into stage 4. I'm going to lay the baby on the ground. My wife gets over here. She brings me the first aid kit. I'm going to ask for the CPR mask. She's going to attach the one-way valve. I'm going to use 2 thumb circling technique. 1, 2, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22. 24, 25, 26, 27, 28, 29, 30. Make sure you open the front door, sweetie. 2 breaths under 10 seconds. We're right back into compressions. 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. I made a mistake. Look in the airway. If I see something, clear it. If I don't, I'm just going to let it be. 1, 2, 3, 4, 5, 6, 9, 10, 11, 12. Front door is open. My wife's out at the street. She's waving out in the street, trying to wave down EMS to get here. I'm going to work that 30 compressions. Look in the airway. If I see something, clear it out. If I don't, I'm not going to put my fingers in the baby's mouth. Give my 2 breaths. All of a sudden, I notice now that the chest is rising. I must have cleared the airway. Baby is not responsive. Get back into compressions. 2, 3, 4. All of a sudden, the baby starts to cry. I'm going to pick the baby up, sweep my arm underneath, hold positive control, and put the baby in a recovery position so they can cough and vomit and fully clear that airway. Wait for 911 to get here. If I do need to, I can sit the baby up here on my lap or on my thigh, sit the baby forward, and let's let gravity assist us in clearing that airway. So choking infant, 1 month to 12 months, consider first aid kit equipment, barrier device, CPR mask, consider your life vac or mouth to mouth. 4 stages of choking, baby's coughing minorly, not a big deal. We're not patting on the back, we're not reaching in the mouth. Phase 2, we're starting to see them turn red. We see a lot of distress in their movement. We're not patting them on the back, we're not putting anything in their mouth. Stage 3, baby is no longer moving air, eyes are open. Baby is moving intentionally, but they are not moving air. At that point, make sure 911 has been called. Make sure the front door is open. If you've got somebody else there, get them out to the street to wave down to 911. That's where we're going to sweep in, lock that leg in place, pinch it, back blows, 5 chest thrusts while the baby is still responsive. If we do clear their airway at that point, we're just going to stick baby into recovery position, angle the baby forward, ensure they get to the hospital. Worst case scenario, we're delivering back blows, chest thrust, baby becomes unresponsive. We're now in stage 4 of choking. Baby's not moving air. Baby is not alert. Baby's not awake. Baby's not moving. We lower baby to the floor. We're going to give 30 compressions, 2 thumb circling, 2 fingers. Look in the airway. If you see something, clear it out. If you don't put your fingers in there. Then use whatever airway device you have to protect yourself from any germs or germs that you may give to the baby. Deliver those 2 breaths or use mouth to mouth. Remember, those 2 breaths should only be 1 second per breath, totaling no more than 10 seconds total to try to attempt those 2 breaths. You're looking for the chest to rise and fall. If the chest doesn't rise, which it probably won't because they are choking and their throats occluded or blocked, move on to the second breath. If the chest does not rise, you've made your 2 attempts. Get back into those 30 compressions. It's going to be extremely stressful. It's going to be extremely scary. Just stay down low to the ground and work those 30 compressions. Look in the airway and attempt your 2 breaths until EMS gets here.